Okay, so today's webinar is on sound-alikes, but definitely not alike. My name is Lisa Thompson, and I will be conducting the webinar today. So as you can see, like, for example, pain versus pain. Now, PAIN would be like that kind of pain, right? And PANE is like a window pane. So see how definitely sounds alike, but certainly two totally different meanings, right? So, okay, so if everybody's ready to begin, I'll start with the first slide. So like I said, just take out a paper and pen and just write it down yourself, and don't bother putting it in the chat box, just so everybody can test themselves and that sort of thing, okay? Okay, so the first one is abduction, abduction, versus adduction, adduction. So one means moving away from, the other one means drawing toward. So I'll give you a minute to write that down on a piece of paper, which one you think it belongs to which word. And a lot of times the doctors will dictate, they'll say abduction or adduction to try, you know, so you can tell what they're actually saying, because it is hard to know, you know, hear which one it is. Okay, I think everybody had enough time. Okay, so the abduction is moving away from, and adduction, adduction, drawing toward. So the tip on that one, just think of abduct as in you're stealing somebody, you're kidnapping someone, so therefore that one's going away, right? So you can kind of use that as a tip. Or, you know, or you can think of a better tip, which you probably can, then, you know, you can, that's the best way of, especially sound-alikes that you get mixed up on. Like, write down what each one means, and then usually a tip, whenever you start forgetting and you think of your tip, then it'll bring it back to you. Okay? Okay, so the next one is accept, ACCEPT, versus except, EXCEPT. Now, one means to leave out or exclude. The other one means to receive willingly. So, to leave out or exclude, or to receive willingly. And remember, you're testing yourself, so don't bother taking the time to research it. You might also just try testing yourself, because I'll give you the answer anyway. So, but of course, when you're working in the course and out in the work world, you would certainly research for sure. Okay, let's see here. Okay, the EX, accept, to leave out or exclude, and accept, ACCEPT, is to receive willingly. So the tip there is, think of an ex-spouse that's out of your life, right? So you can ax and out or exclude, so you can kind of put that together. So for accept, just think ex-spouse, and, you know, to leave out or exclude. Okay? All right, how about number 6, access, ACCESS, versus excess, EXCESS. Now, one means to approach, and the other means more than usual. So ACCESS versus EXCESS. One means to approach, and the other means more than usual. So ACCESS, access, means to approach. And EXCESS is more than usual. So EX, just think of that as in extra, like too much. And, then you would know it's excess means more than usual or too much, or, you just have way too much of something. Where access, that would mean, that you gained access to, I don't know, the locked door to the room or something. Something like that. Okay, so let's see here. Number 8. Acidic, ACETIC, versus acidic, ASCITIC. Now, one means accumulation of serous fluid in the abdominal cavity, while the other means sour. So, acidic, ACETIC, versus acidic, ASCITIC. And see where it sounds so close together? That's why a lot of times, too, if you're not sure what they mean, like look up the meanings and then you check out the sentence that it's used in and how it's being used. And that will tell you right there which one it should be. Okay, let's see here. So acidic, ACETIC, means sour, where acidic, ASCITIC, is accumulation of serous fluid in the abdominal cavity. So the tip there is think of as, so accumulation of serous, as in serous fluid, or acid, AC, as in sour, or acidy. So like I said, if you don't know, you just find out the meaning of each one, and then you check how it's used in the context of the sentence and go from there. So if they're talking about fluids that were built up in the abdomen, then you would know it's acidic. Okay. 10. Afferent, AFFERENT, versus efferent, EFFERENT. One means toward a center. The other one means outward from a center. So toward a center, and the other one outward from a center. Just give you a second. Okay, so efferent, EFFERENT, means outward from a center, where afferent, AFFERENT, is toward a center. So the tip there, just think of E, like the starting of the word, as in exit. So you're leaving, right? So outward. And like I said, you can come up with your own tips as well, because it gets hard after a while trying to think of a tip for each one of them. But anyway, you most certainly can use your own tips, that's for sure. Or if you have a really good one that's, better than the one I'm using, you can certainly type it in the chat box if you... For this one, I use it as add toward. That's right, exactly. That's right, Winona. That's a good one too. Use the as add, meaning toward. So whatever works to help you decipher between the two? Definitely. Okay, here's a good one. Yeah, that's a good one too, Susan. Alkalosis, ALKALOSIS versus ankylosis, ANKYLOSIS. So one means immobilization of a joint, while the other means increased alkalinity of blood and tissues. So alkalosis versus ankylosis. I mean, when, you can almost hear the difference when a person talks normal speed and stuff like that, but as you know, the dictators certainly don't do that. So a lot of times it's hard to hear if they're saying al versus ank, like elk versus ank kind of thing. Okay, so ankylosis, ANKYLOSIS, is immobilization of a joint, where alkalosis is increased alkalinity of blood and tissues. So the tip there, ank, as in ankle. And of course, then you could think joint, right? So I'll just give you a minute in case anybody is writing this down, just give you a minute on that. So ank as in ankle. Ankylosis, immobilization of a joint. Okay, here's a good one. Anuresis, ANURESIS versus enuresis, ENURESIS. So one is retention of urine in the bladder, while the other one means involuntary bedwetting. So retention of urine in the bladder, and the other is involuntary bedwetting. Because you hear that quite often in reports, especially when you get out there in the work world too. You hear it quite often, like both of them, both words. So, and it's certainly hard to tell if they're saying anuresis or enuresis. But once you know the meaning of both of them and you see the context in which it's used, you certainly will know which one it is for sure. So enuresis, ENURESIS, is involuntary bedwetting, where anuresis, ANURESIS, is retention of urine in the bladder. So the tip with that is EN sounds like in, or E as in bed. So you can go like EN for in. Oh, I have something covering my screen here. Let's give it a second here. Let's guess. As is without. Uresis is urinating. Yeah, so anuresis, of course, is the retention of urine in the blood, and EN sounds like in, or E is in bed for bedwetting. Or Chantel said she used the E for exit for this as well. That's right. If you want, like I said, anything at all, that works for you, that you can use, then that's great. Kelly, I think of A as absent. Yeah. Okay, so let's see here. 16. Yeah, that's right. Absence of urine. That's right. Aphasia, versus, so aphagia versus aphasia, aphasia. So one means difficulty speaking, and the other one means difficulty swallowing. So aphasia versus aphasia. And as you can tell, it's very hard to, hear the difference in the pronunciation of it. So that's why, again, you'd have to rely on knowing which, what each one means, and then looking at the context of the sentence on how that word is being used for you to be able to figure out if they're talking about speech or swallowing or whatever. So aphasia, aphagia, is difficulty swallowing, and aphasia, aphasia, is difficulty speaking. So tips for that, I just put S, so S, for speech, right? Or G, the G there, as in esophagus. Because, when you swallow, of course, the food or liquids go down your esophagus. So, okay. I assume everybody has that. Okay, so 18 is complement, C-O-M-P-L-E-M-E-N-T, versus complement, C-O-M-P-L-I-M-E-N-T. One means that which completes or makes perfect, and the other one is an expression of praise. So one is that which completes or makes perfect, and the other is an expression of praise. I'll give you a second there to write that down if you're writing it down. Okay. So we have complement, C-O-M-P-L-I-M-E-N-T, is an expression of praise. So you're complimenting somebody. Oh my, don't you look nice today? Or, you have a lovely hairdo, or whatever. And complement, C-O-M-P-L-E-M-E-N-T, that which completes or makes perfect. So you'll often hear maybe somebody saying, like, he or she complements each other. So, like, in other words, they're good together, good couple, whatever. So the tip for that is I, as an I, compliment, and praise has an I in it as well. So, and like I said, there's definitely room for, whatever tips you come up with is fine. I just tried to think of stuff to throw out there to help you. Here's one that students always get mixed up on, okay? Discrete, D-I-S-C-R-E-E-T versus discrete, D-I-S-C-R-E-T-E. Now, one means separate or individually distinct, and one means reserve in one's speech or behavior. Okay, so separate or individually distinct, or reserve in one's speech or behavior. Okay. So discrete, D-I-S-C-R-E-E-T, is reserve in one's speech or behavior. So you're being discreet about something. And discrete, D-I-S-C-R-E-T-E, is separate or individually distinct. I can't even talk. Distinct as in discrete mass, which you'll see that a lot in the physical exam section. So the two E's is in discrete, like in speech. So you're being discreet about something. But the discrete is what you're going to find, like 98% of the time it's going to be this. And especially if it's in the physical exam section. That's the one you'll be using. Because they use it as, when they're talking about masses and in one of the organs or whatever. So remember that. Most everyone gets this one wrong, I believe is what she's talking about, Cecilia. Because everybody puts this, usually. But that there kind of discrete is, when you're, you don't want to make something obvious. So you're trying to be discreet about it. Where this one, the discrete, that's the one like I said, it's usually used mostly in the physical exam section of a report and stuff. This is the one that they're talking about, the discrete. Yes, Kelly, definitely that one's tricky, and like I said, I see that so many times as an error, for sure. But usually, like I said, when they're referring to a mass or something, they'll use discrete, or if they're talking about nodes or something like that. Okay, so, and I see this error a lot too. Gate, G-A-I-T versus gate, G-A-T-E. One is an entrance or opening. The other one means walking. Yeah. G-A-I-T versus G-A-T-E is an entrance or opening or means walking. So G-A-I-T means walking. That is the one that you're going to see in medical reports, okay? And the G-A-T-E is an entrance or opening, like he opened the gate to let the dog in or something. And the tip is 8, as in opening your mouth. So gate is entrance or opening. So, but remember, this is the one right here. Very seldom are you ever going to get a report that is talking about, a gate that you would open, to walk through or something like that. This here, whenever they're testing somebody, watching the patient walk to examine their gait, to make sure they're walking, they're steady on their feet, or they're not limping, or they're not tending to, say, go sideways, that sort of thing. So, ilium, I-L-E-U-M versus ilium or ilium, I-L-I-U-M. Now, one is a portion of the bowel, while the other one is part of the hip. So, let's see here. Have ilium is a portion of the bowel, so the I-L-E-U-M is a portion of the bowel, and the I-L-I-U-M, ilium, is a part of the hip. So tip, that's right, I as in hip, or E as in bowel. And while I'm talking about that, it just hit me. Make sure you proofread your reports carefully, because I don't know how many times I've come across that students type in bowl, or it was already typed that way and they didn't notice that it said bowl instead of bowel. But if you proofread, you'd know it wasn't bowl because they were referring to the vowel. You know, the vowel sounds normal, or, you know, whatever. Okay. Infarction, INFARCTION, versus infraction, INFRACTION. One means breaking of a rule. The other one is necrosis caused by obstruction. So breaking of a rule or necrosis caused by obstruction. Infarction versus infraction. Okay, so an infarction is necrosis caused by obstruction, as in myocardial infarction. Infraction is breaking of a rule. So your action broke the rules, or like fractured as in break, or fracture as a fraction on a ruler. The rule. Sure. Yep. That works too. But remember, whenever you hear MI or myocardial, it's always infarction. INFARCTION. Or a lot of times I'll see students type, instead of infarction, they're typing injection or something. So, yeah, you have to be careful. Definitely always make it a point to research anyway, if you're not sure what something means. Susan, and this would be one that spell checker would let pass. Well, see, that's the thing. That's why you can't always totally rely on a spell checker, which you shouldn't, because a spell checker would have no way of knowing which word is proper, and, you know, which medical word. All it checks is to see if it's spelled correctly, but it doesn't know whether, well, that's the correct word for the context of that sentence. So, yeah, never just rely on a spell checker, not when it comes to medical words. Okay, so labial, L-A-B-I-A-L, versus labile, L-A-B-I-L-E. So one is pertaining to a lip or lip-like structure, while the other one means unstable. So pertaining to a lip or lip-like structure, and the other means unstable. So labial, L-A-B-I-L-E, means unstable, as in a labial blood pressure. And again, that's where you'll see that used a lot in the physical exam section, plus other sections of the report, but especially there. This is the one that, yeah, you want to remember it with anything that they're talking about that is unstable. And labial, L-A-B-I-A-L, is pertaining to a lip or a lip-like structure. So you can think about well, that wouldn't make sense. Well, I pierced my lip. It was a labial piercing. Because see, lip, labial piercing. I don't know. It was hard to come up with a tip, but anyway, if you can come up with a tip, then that would be good. I imagine the most reports that you would find labial, L-A-B-I-A-L, would be in the gynae reports, gynecology reports and stuff like that. They might possibly talk about something like that. But the biggest majority of the time, this is labile. L-A-B-I-L-E is what they'd be talking about, like the one that's spelled like that. Labios, lips in Spanish. This is how I remember this one. And dental. Yeah, Michelle, dental. Although, I don't. The teeth wouldn't have much to do with the lips, but one never knows. One never knows. Okay, loose, L-O-O-S-E versus loss or loose, L-O-S-E. So one is not securely attached, and the other one to misplace. Loose or versus loose, L-O-O-S-E, loose versus loose, L-O-S-E. Not securely attached or to misplace. I know a lot of times I have to stop and think for a minute. Okay, do I do 2 O's or 1? So L-O-O-S-E is not securely attached, and L-O-S-E is to misplace. So, you know, in other words, you lost something. My tip is the moose is loose because it has 2 O's. So if the moose got loose, they're not securely attached, right? So anyway, but that was just the only thing that could come to my mind at the time. So you could probably think of something better than the moose is loose, but anyway. That's funny. I thought of loosey-goosey right away. Yeah, whatever works. Lose, lost the second O. Yeah, that's really good, Chantel. Yeah. Lose, lost the second O. I like that. That's good. Like I said, my mind was getting pretty boggled there by the time I was getting down to these ones. But that is good. Like that. Okay, mucus, M-U-C-U-S versus mucus, M-U-C-O-U-S. So one means slimy substance, while the other one means membrane that lines various cavities. And I know a lot of people get mixed up on this one. M-U-C-U-S versus M-U-C-O-U-S. So one is slimy substance, the other one is membrane that lines various cavities. Okay. So M-U-C-U-S, mucus, is a slimy substance, where the M-U-C-O-U-S, mucus, that means membrane that lines various cavities in the body. My tip for that is think of pus in place of cuss. So pus would be slimy, right? A slimy substance. So remember, that is the membrane, M-U-C-O-U-S, but the substance is the M-U-C-U-S. Okay, everybody has that written down. Okay, palpitation, as in P-A-L-P-I-T-A-T-I-O-N, versus palpation, P-A-L-P-A-T-I-O-N. Again, a lot of people get that wrong as well. One is feeling with the fingers, Another is an abnormal rapid heartbeat. Palpitation versus palpation. Okay, so palpation, P-A-L-P-A-T-I-O-N, is feeling with the fingers. And that's when a doctor, will kind of tap maybe sometimes on your back while he's moving around with the stethoscope kind of thing. Palpitation, P-A-L-P-I-T-A-T-I-O-N, is an abnormal rapid heartbeat. When all of a sudden your heart just feels like it's beating right out of your chest, So my tip was pat, as in patting someone's back. So pat here. Or the heart goes pitter-patter. Oh my God. As in pit, see, pitter-patter. So you can, the heart goes pitter-patter, as in palpitation, or pat, as in patting someone's back. I've lost sound. I have to, okay. Yes, had to rejoin. Oh, goodness. Had to rejoin. Oh, well, that's too bad. Wow, that's terrible. Did you people lose or miss very much? I'll probably make this into a PDF form as well. So that way there, anybody that misses any or part of, the webinar here, I'll get them to load. Well, they'll automatically load the webinar, but I'll get them to load a PDF form of this webinar. So that way there, you can always check that out and print it off and that sort of thing. Amanda's first time joining live, and I'm late, of course. I have no sound. Oh, good. Would be nice to have the PDF form. Yeah, no, I will definitely do that for you. Okay, so let's see here. Perennial, P-E-R-I-N-E-A-L, versus peroneal, P-E-R-O-N-E-A-L. So one means the region between the legs. The other one means outer or fibular side of the leg. So perennial versus peroneal. Region between the legs or outer or fibular side of the leg. Okay, let's see here. So peroneal, P-E-R-O-N-E-A-L, is the outer or fibular side of the leg, where perennial, P-E-R-I-N-E-A-L, is the region between the legs. So for a tip, in, as in between the legs, like as in between the legs, or O for outer or fibular side of the leg. Okay. Plain, P-L-A-I-N, versus plain, P-L-A-N-E. One means not fancy radiograph. 2, anatomic level. So not fancy radiograph or there's one, anatomic level. Plain, P-L-A-I-N, is not fancy radiograph. So a lot of times a doctor will order a plain radiograph, and that's what they're talking about. And you have to spell it P-L-A-I-N. Or P-L-A-N-E is an anatomic level, as in sagittal plane. So plane, as in airplane, must be level, right, when landing. Or they should, or it could be bad news, if you know, or whatever other kind of tip you can come up with that, you know. And it's just like if they say patient received Marcaine plane, it would be that kind of plane as well. Injection. Okay. Okay, principal, P-R-I-N-C-I-P-A-L versus principal, P-R-I-N-C-I-P-L-E. So one is a ruler or standard, the other one is a leader. So ruler or standard, and another one is a leader. So principal, P-R-I-N-C-I-P-A-L, is a leader, as in a high school principal. And then principal, P-R-I-N-C-I-P-L-E, is a rule or standard. So you can think of PAL, I suppose, as your leader. But also, when they talk about principal diagnosis, that's what I should have added in here, this is the spelling that you would use, not this. Because a principal diagnosis isn't a rule or a standard, okay? But principal, that can be, you know, like a leader, as in a high school principal or whatever, but it can also mean like a diagnosis. So this is the one spelling, so you may want to mark that. Okay, here's one people kind of mix up as well. Prostate, P-R-O-S-T-A-T-E versus prostate, P-R-O-S-T-R-A-T-E. That's right, Kelly. And that's why that spelling, Kelly, goes with diagnosis. Because where it can mean primary. Exactly. So prostate versus prostrate. One is stretched out with the face upon the ground. The other one is a gland of the male urinary tract. So stretched out with the face upon the ground, or a gland of the male urinary tract. Okay, so prostate, P-R-O-S-T-A-T-E, is a gland of the male urinary tract. Remember, there isn't any R. The prostate, or the prostrate, is stretched out with the face upon the ground. So when you're laying face down on the ground, that's prostrate. So S-T-R, here, stretched, or, you see you have STR there as well. So STR, STR. Stretched, or you would be in a bad state if your prostate became enlarged. Jeez. I don't know what I was thinking there, but anyway. Think of whatever, you know. But this here unless they're talking about a patient's a certain position that, say, they found the patient in, or they had to put them in a certain position to do a certain type of operation or something like that, then it would be that. But other than that, when they're talking about, it has to obviously be a male, and if they're talking about, you know, urinary or the gland or whatever, it's prostate. 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 Okay, got it. Okay. Thank God. Okay, here's another one. Shoddy, S-H-O-D-D-Y versus shoddy, S-H-O-T-T-Y. One means poor marksmanship or quality, and the other one is resembling buckshot. So shoddy versus shoddy. Poor workmanship or quality, and resembling buckshot. Okay, so shoddy, S-H-O-D-D-Y, is poor marksmanship or quality. And shoddy, S-H-O-T-T-Y, resembles buckshot. And that's why a lot of times they will, in a report, they'll say the patient has shoddy nodes, but it's S-H-O-T-T-Y. And the reason why, because it looks like buckshots, that the nodes have a bunch of little holes all in it. And that's, so think shot as in buckshot. So shoddy. This is what you'll see appearing in medical reports. Unless, you know, they're talking about some, I don't know, operation, I suppose, that the patient may have received somewhere and it didn't go so well, then it would be shoddy, I suppose. But other than that, if they're talking about nodes or a mass or whatever, it would be S-H-O-T-T-Y. Okay, so down to the last two slides. And if everybody gets this right, okay, if you all get it right, then I will do this webinar in a PDF form, okay? Okay, here it is. Okay, Lisa, L-I-S-A versus Lisa, L-E-E-S-A, all right? So one is just another way to spell the name of the wonderful, knowledgeable, humorous instructor, or wonderful, knowledgeable, humorous instructor. Okay, so the answer, of course, is, well, Lisa, wonderful, knowledgeable, humorous instructor, can scribe, and Lisa is just another way to spell the name of the wonderful, knowledgeable, and humorous instructor, can scribe. So for your tip there is think Lisa, instructor at can scribe. Okay. Anyway, I hope you all learned something. Thanks, Celia. And I will make a PDF form of this webinar that I'll get them to post in the forum along with it. Oh, that's great. Because I really try to think of webinars that, you know, you're going to find helpful, and I try to do them in a way that it's interactive as well. So great. That's a good idea, Joan. Where is the form? It's in the course, Cecile. You'll see it beside the content tab in your in the course. Okay, would love to see another for researching Appendix C and AHDI EBOS. That's right, Appendix C in the Book of Style for sound-alikes. There's a lot of them in there for sure. Okay, well, I hope you all have a good rest of the day, and everybody, please, yourself and your families, stay safe. And I'm sure I'll be talking to you all again. Very informative. Thanks for answering. Really appreciate your time. Oh, you're very welcome. Thanks. Thank you. Appreciate that. Thank you. Okay, bye for now.